Nathaniel was diagnosed while I was 19 weeks pregnant with several congenital heart defects and some kidney complications. So he was born, and we were home for 12 days. And Nathaniel, we found him blue in his swing.
Ugh.
So, which is, as you know, as a mom, is just every parent's worst nightmare.
Yeah.
The second the doors opened to that cardiac ICU and I saw Ryan, his cardiologist is standing there, and there's about 20 specialists around him. Just immediately, I was like, he's going to be okay. Like, Ryan's here. You can't put that into words, the appreciation.
Yeah.
As you know, as a mom, you're supposed to be able to be the person that your child relies on, and the person that's supposed to be able to, like, kiss the boo-boos and shoo away the monsters and make everything okay.
Yeah.
And this diagnosis for us, this was just something that I couldn't fix. And truthfully, if not for Boston Children's Hospital, I would not have the experience to be a mom. I would not have the opportunity to shoo away the monsters and make everything else better in his life, and wipe the scraped knees and have all the nighttime snuggles and every other thing in between, And this whole time with this diagnosis, we had said he just needs to make kindergarten. Like, if he makes it to kindergarten, then he's going to be okay. So we celebrated his 5-year heart anniversary on September 4th, and the very next morning we sent him to kindergarten.
Oh, I love that. How sweet.
Yeah, so it was a joyful week, I'll say.
Hi, I'm Louisa, and this is Any Job Can Be a Climate Job. That was Kristine Rodman, Nathaniel's mom. I wanted to start with Kristine because her story really captures something we don't hear often enough about hospitals. That behind every procedure, every hallway, and every quiet moment of care, there are hundreds of hidden decisions and people and workflows shaping what that care looks like for patients and for the planet. Today, we're stepping into one of the most resource-intensive rooms in the entire hospital, the operating room. Fast, high stakes, and full of waste streams that most of us never see. And what I love about this story is that climate action is not coming in as a top-down mandate or some new policy that everybody has to follow. Instead, it's the individual people on the ground floor who are making these changes to workflows, collaboration with their teammates, and starting to notice things and ask questions like, why is there a batch of clean towels going into the trash? Oh, and if you're enjoying the show, please do give it a like and subscribe. It really helps out. And with that, let's go into the operating room with Julian Inferrera of Boston Children's Hospital. Julian, can you start off by introducing yourself, your name, role, and maybe a sentence about what you do day to day?
Absolutely. My name is Julian Inferrera. I am the operating room flow manager at Boston Children's Hospital, and I have the privilege to manage the team that cleans and sets up between surgeries in the main operating rooms.
A quick note on Julian's audio. He joined us from a storage closet in Boston Children's Hospital, and there are a lot of fans in the background. My amazing editor, Alex Leff, did his best to take out that noise, but at times it might feel a little garbled. Just wanted to give you that context. What would you say is the biggest lesson you've learned about taking climate action that will stay with you for the rest of your life?
Oh, biggest lesson. That's a big question. We can do a lot more together than we can do alone. A lot of these efforts come down to individuals making decisions to either divert materials through the right waste stream or to make opportunities for folks to reuse things that are clean and able to be reused. But working together with other groups and departments, you get more stakeholders and you can gain a lot of momentum around things. And also, you don't have to do everything yourself.
Yeah. And was there a moment that in the OR that made you realize, oh wow, this is climate work?
Fortunately, the timing of me starting in this role in the formation of our environmental sustainability department, it just seemed like a good opportunity to connect with the person who was starting that group. So Catherine Lewandowski, she's the director of that group, and there was some clinical outcomes opportunities to get connected with single-use instrumentation. So I'd previously worked as an anesthesia tech, and we use disposable, like one-time use bronchoscopes or laryngoscopes that can actually get refurbished and then reused.
Oh, interesting.
And so that was an opportunity, and this is all done through the manufacturers, a lot of the medical equipment anyway. I found out that there was opportunity to get involved in initiatives like that. And then from there, and that was connected to Catherine Lewandowski and clinical outcomes groups that she does monthly. The scope of the work that I do is under the nursing umbrella at Children's. And that's a little different because it is what most folks would see as actorial work, but there's tons of interdisciplinary workflows that actually are parallel to what other departments are doing. So we have this opportunity to collaborate with them to make sure that all of their waste and resources and materials go through the appropriate waste streams.
All right, Julian, I would love to get into more specifics about what your role is. Operating room flow manager. Take me through what a day in your work looks like.
Well, from a business perspective, we are adding value to the organization when we're providing surgical intervention. And there's this non-value added time between surgeries. And so there's lots of different participating departments in between surgeries that go into this non-value added time. And so the flow of the day in the OR kind of depends on what a lot of other people are doing a lot of the time. And so this is this collaborative role where I get to work with the other departments that go into participating for the turnovers and try to find ways where we can grease the wheels.
And what are some of those other roles that are going in between surgeries in the OR?
Before a patient rolls in, we have obviously there's a surgical tech, there's nursing, there's anesthesia representation, and then there's oftentimes other groups that are kind of going into supporting this. So we have radiology technology, and just in general, this is just anesthesia's got different aspects of their services there as well. So there's tons of different players involved in this. They needed somebody who was going to be able to kind of bring everybody together because we have this like really, really confusing picture about whose responsibility it was to clean what.
That's a lot more people than I expected to be in the room between patients. So thanks for sharing that. Tell me more about this confusing, like who cleans what. What's that look like?
Well, not my clean team, Severin.
Oh, okay. How did that happen?
This is an initiative to try to decrease the time between cases. And so the opportunity is that we get to learn and get familiar with the workflows that these other departments are using their equipments, and so that we can kind of meet them where they're at to help speed things up between the cases. So again, for example, anesthesia techs are going to be busy setting up the IV for the next patient, getting all the intubation equipment, the breathing circuit, and they're going to be using ultrasound. If regional as a service is going to be involved, perfusion's involved, anesthesia techs are going to be busy kind of supporting all the care that's going to go into the patient, as well as surgical techs are setting up all of the surgical instrumentation and staging the room, making sure that the patient has all the equipment that they're going to need open and sterile. This is all happening before a patient even comes into a room. So when the patient comes in, then they get on the table and they bring the transport stretcher or bed out. Then they're actually ready to do surgery once the patient's been safely induced. So just in order to get the patient into a position where they can get surgery, you have 3 or 4 different departments going into just little bits of work that are going into getting them there. So, once one patient leaves the room, instead of, tasking those teams with cleaning and then setting up afterwards, they've enabled my team to learn to decontaminate all these specialty equipments. And then they can kind of do that while these other respective groups are getting things ready. And it gives folks who are filling these roles opportunity to see what's a little beyond their on the horizons, which is great.
Yeah. And what is the typical turnover time between surgeries?
When it's all said and done, it's right around 20, 25 minutes.
Wow. That's pretty impressive.
The clean time is on a top end, probably 10 to 12 minutes. Well, that's just decontaminating. So once one patient's left the room, getting the room ready to be having sterile packs open back up in it, that's probably just under 15 minutes. Fortunately, I get to collaborate with folks who look at all these analytics, and we get to make data-informed decisions based on what my team is kind of inputting. So what they're doing is they're adding timestamps that, turnover claimed, cleanup start, and then cleanup complete. And we've got different intervals that we're able to calculate different portions of those room readiness based on when they're inputting timestamps. And so part of this is making sure the data is valid and true, and getting them to understand how to do Macarena, so to say. Because again, if they're doing the wrong part of the dance at the wrong time, it's not going to look right. So trying to get them to do everything at the right time during the sequence of the turnover, it's a lot of training and coordinating teamwork and encouraging, efficiency, and obviously prioritizing patient safety while we're doing all of that. And it's been a really humbling experience.
I think you said it was like a NASCAR pit crew.
Yeah. Well, they've been lovingly coined the pit crew. Yeah, we've looked at pit crew videos, literally watching like what they're doing for Formula F1 and NASCAR, and we see under 5 seconds, like a car gets all the wheels changed, filled up with gas, and it's all because they practice, and everybody knows before the car stops in there, what are they doing? And they refine every movement. And so just kind of taking that methodology and just trying to extrapolate what we can from there to try to implement good sound workflows where people are being deliberate about everything. It's definitely helped not just in efficiency, but we've actually seen through environment of care walkthroughs where we screen the environment for dust, like the dust burdens have gone down because instead of having like a really chaotic picture where there's 15 different groups responsible for like little bits and pieces of the room, it's one team and they're really trying to take ownership of the clean aspect of it.
Right. Okay. Wow, that really paints a picture. It's about reducing the amount of time, obviously within staying your guidelines around sanitation and cleanliness, because this is an operating room, so you have to be very sterile, which sounds really hard in general. And then to do it in 25 minutes is crazy. But can you describe the waste streams that you see in the operating room and how you've tried to change them?
So there's linens, there's trash debris, there's also recycling, there's also biological burdens. And so trying to make sure everything is put into the correct waste stream, all within that time frame, it's a lot's happening at once.
Can you kind of paint a picture of it?
Well, we have suctions that are filled. So a lot of it is trying to remove the debris from the previous patient. We call it pulling the trash, yeah. So lots of irrigation gets suctioned out of the surgical site.
Where does that go?
It goes into a suction canister or a Neptune. And a Neptune is kind of like a portable machine that adds all that suction force. If not, we're tapping into the pipelines that are built into the walls.
Oh, wow.
Yep. So
I had no idea.
We had filters between the wall and the suction canister. We're using these suction canisters to house biological debris and fluids that we're sucking out of the surgical site. The Neptune is like, you can really kind of get down into the fine tuning of the pressure. Mm-hmm. Again, harvesting all the red blood cells off the surgical site. Then they can clean it, and then they can reinfuse the patient's blood back into them. And so again, trying to make sure that these rooms are outfitted for all this types of care. It's an opportunity to take some pride in being able to help patients receive safe care. It's pretty cool.
Absolutely. Okay, so all right, so there's suction that happens for all of the blood and stuff,
and smoke potentially if they're using cautery. The Subovi is
right.
Electrical currents are kind of going through a patient, and they're able to cauterize things and kind of burn right at the site. They can keep everything kind of contained. But again, folks who are getting exposed to that it's carcinogenic and it's really bad for their health. But making sure my team is understanding that if we see, the reservoirs that they have, for example, those are going straight into the biological bin, whether they're empty or full. If we see a suction canister that has bits of chipped blood because essentially air has been passing over throughout the whole duration of the case, is because it's pulling bits of patient's debris that were at the tip of the suction lines that probably enter into they go into the suction canister. So we really have to play detective when we walk in.
That's interesting.
We start by pulling, the sheets off the bed, pull all the suction canisters, make sure we're pulling everything up off the ground. wipe everything down, and then we're going to mop the floors. And then we have to get the sheets back on and get all the suction canisters reinstated and make sure to
Wow.
have the right lengths of cables. So, like, another part of this was being collaborative with the anesthesia group to make sure that they had the right cables available to them. And so we wanted to streamline and get everything standardized. But if we reduced everything to 12-foot suction cables and they need 18 feet, we need to keep that available for them. So just being someone who's familiar with the workflows that they're doing, and I'm not just tell them, hey, this is what you got now, because you understand the nuance of the service that they provide. They need to keep that suction line that's going from the wall to their reservoir. It needs to be kind of out of the way. Again, they're only going to use
makes
it
sense.
for a portion of the case while they're trying to harvest that blood or the whatever they're just harvest off the incision site. And then that has to be cleaned sterilely and handed off sterilely for all that to go back in. And this is all happening during sterile procedures. And so again, trying to keep all those things available to them so that we can still support that type of care. It's not as simple as just making a decision and we roll with it. And then we have like MRORs and they need 6-foot suction tubing. And it's just trying to make sure we can cater to all the different types of needs that are going on as well.
Yeah, it sounds like a lot. Okay, so there's the tubing and the biological waste. I'm thinking about what else gets thrown out after a single surgery. There's
drapes,
towels.
Well, we have towels, we have surgical huck towels, we have drapes that are going up to keep the sterile field kind of isolated and contained, even though it's just the patient. So if we're in the thoracic cavity, there's a specific sequencing into the surgeries, right? So regardless, we have all this material going into keeping everything staged the right way so they can like compartmentalize the surgeries and do things like very safely and clean. And then at the end, we have all this debris and we have the surgical huck towels that are only single uses, and they even use them in the sterile kits. So
wow.
One initiative we've got here at Children's right now is we're trying to collect all the clean surgical huck towels that they used in the sterilization process. And then we can offer them cleanly to our environmental services colleagues. And they'll use them on the floors to contain wax as they pour it on the floors. So they can actually target specific areas. It seems pretty helpful to them so they can be strategic about things.
Can you describe what a huck towel is?
It's like a very thin, mildly absorbent cloth that they use to kind of keep things organized in the surgical site. Or like I've hinted at, they use them in sterile processing as well to buffer, because it is permeable. They can put them in the kits and they can still sterilize them with steam.
Okay, how big are these? Like the size of a washcloth, or
Probably the size of a normal computer monitor. Just about.
Okay.
Yeah, washcloth. That's a good comparison.
Okay. And then, and so these would normally just get thrown out after surgery, but you're saying these are kind of like unused or not as contaminated?
We have some workflows that leaves them sterile, and then they come kind of crinkled up in these sterile kits. And when one of our nurses had noticed that these were all just going clean right into the trash. And so some of the nurses saw this and they took, they would just say, hey, this is still clean. I can use this at home, whatever. But then we took that and we said, well, maybe we can just collect these between the rooms and we can actually give them to departments who would use them for work here.
And so janitorial to clean the floors.
Yep.
Got it. And so naive question here. If they're still sterile, why couldn't you use them for another patient?
The IFUs on them suggest that they can only be sterilized once.
The IFU, what's that?
It's just a
manufacturer
rule book to use this product, essentially.
What would you say surprised you the most once you started paying attention to the waste in the ORs?
When I first started working in a surgical environment, the volume of waste. I am assuming you've seen there was an art piece done by somebody within the past decade who I think it was a breast reduction surgery, but they actually collected their whole surgical debris that they could.
Oh, wow.
So the hospital gave it back to them. And then they had this big display that it just, if you see how much compared to one person, just the vast area that goes around them with everything kind of organized and placed around them, it's a very significant space.
I can imagine. I'm going to have to look that up. I'll put a link in the show notes as well.
As an ORA, I got to do the physical labor going into it. So I started as an ORA at the Brigham, and I got to actually
What's ORA?
Operating room attendant. So it's the title of essentially the person who's cleaning and setting up between those cases. And so seeing the volume, that one leave each one of these ORs after the cases is extensive. I've never seen anything like that before. And I'd come from working in construction.
Wow.
Where I'd see a lot of debris, heavy debris leaving for these big jobs. But these are huge, they're doing big renovations and things like that. And
Yeah.
demolition is usually when you see all the trash leaving anyway. Surgery,
Right.
this is happening multiple times every day in each one of these rooms.
So what types of waste are unavoidable and which have room for change?
There's going to be an unavoidable biological burden that goes out. Patients' debris. Essentially what happens is we get the biological burdens and then we cook it with pressure and then it becomes normal trash after that. But that's always going to exist. So there's always going to be some sort of a physical trash debris coming out of these surgeries. If we can find ways to divert clean wraps, those are opportunities to reduce the amount of trash that's going into these things. When it comes down to it, trying to make sure that we're taking everything that's contaminated from the previous patient. So there's a laundry service. Obviously, that's not going to go anywhere. However, we are looking at implementing a barrier between the linen and the patient, which is only going to cause extra waste.
Yeah.
So
why would you do that?
If there's anything from the research world that would suggest that this would increase safety from an infection prevention and control standpoint, that's a sacrifice we have to be willing to make. And so those types of preventative barriers, I don't think are going to go anywhere.
And in that case, so how is your team thinking about that?
We look at it kind of as it's a necessary addition to keep the patient safer. We ask ourselves if we would feel more confident if it was us or our family members getting surgery in these environments. Is that something you'd want to see? And if the answer is yes, then that's something we should automatically, innately be comfortable with adding to meet safer surgeries. And there's less of a chance of a patient having a surgical site get a post-op infection. That's a good thing.
Yeah, that makes sense. And did you say earlier that to the debris, that the trash that you end up taking out, did you say you put it under pressure and it sanitizes it somehow?
Sort of.
Did I get that right?
We have a Sandy Pack. That's what we call it. If you Google what a Sandy Pack is, that's a SAN-I-PAC. And this is a technology that we've used to reduce infectious outputs. So essentially it uses, from my understanding, and again, we'd have to talk to the directors of the Environmental Services Department. They have to work with this thing and get this thing maintained. But essentially, it's like a vacuum pack with pressure involved, so and heat. So that whatever the end result is going to be something that can be moved out to the general waste stream.
Interesting. Okay. Oh, that sounds like a big savings then if you don't have to dispose of it in a...
The other way we dispose of it is a literal handoff. So this is a Longwood site. We have Sandy Pack here, but we don't have that in some of our satellite locations. But that stuff you'll have to talk more about with probably Catherine Lewandowski.
And then coming back to the Huck towels. So what was the project that you worked on there?
We've had nurses that have worked in this environment for longer than I've even been alive. And they've really kind of taken it upon themselves to intentionally create workflows that will help reduce the amount of redundant waste. So again, if we're taking, and this is this example of like observing clean towels coming out of sterile kits and going straight into the trash, well, that could be used elsewhere prior to going into the trash. And so just based off of logic and rationalization, trying to come up with the best possible use for it and having a discussion about it seems to have gotten us at least to a place where our infection prevention and control colleagues are comfortable letting us use these again on the floor before throwing them away.
Yeah, what did those conversations look like? What did it take to prove that they could be reused safely?
Listening to what they're comfortable with, and then taking is there anything that you guys are comfortable with us trialing this on, and then if they say you can floor care, limiting what they use it on to only floor care, and just trying to be collaborative and encourage folks to go the extra mile when necessary to do what we can to try to be exemplary. If you want to lead in pediatric healthcare, you can't just talk the talk, you got to walk the walk.
And so now they're being used with floor care through janitorial, but how did you make that connection? People were taking them home before. How do you make the jump to
Well,
floors?
I will tell you, I haven't stopped them from taking me home. So if they want to, if we have some
Sure,
missing
yeah.
towels, we're not gonna account for that. But the idea came from the nurses that were doing this already. So the intentions were
Mm.
to save waste, not waste things
Mhm.
you can produce. They started a committee here back in like 2005, I think. It was called the LEAF Committee. So it's Leave Earth the Future. And these same nurses
Mm.
that started it back then, were the ones that really kind of, welcomed me in when I started in this role to this type of workflow. So just trying to be thoughtful and deliberate about this. And, if they've since retired, trying to keep their legacy alive by continuing it is important to us. So,
I love that. And so how many Huck towels are we talking about in a typical day or a week?
I just, today, I can tell you about weekly, the bins get pretty full. I just moved out 4 kilograms.
Four
So,
4 kilograms,
yeah, so
okay.
4,000 grams, and then it's about 50 grams per towel. So that was about 80.
4 kilograms today, you said, and that's about 8,
So
almost 9 pounds, it looks
just
like.
under 100 towels. Yeah.
Wow. Is there an opportunity to, and maybe this is not good for patient safety or preparedness, but to reduce the number of towels that are in the OR in the first place, if there's all these excess?
I don't know. But if there isn't, we're still looking at other opportunities to save them. So they incidentally end up in the linen bin sometimes. And when they do, our linen partners already have a process on their end where they're cleaning these things and getting them to a point where they can be resold to car washes.
Oh, interesting.
So the next step in this pilot is to collaborate with them and give them all the dirty towels too on the side, not mix
Right.
them with our linen as a
Yeah.
biological. And then they have the service already to clean linens, so they can take these and they can potentially launder them and then resell them.
Oh, wow. Okay, and today those Hug towels are going through that Sani Pack process?
They should. That's where they're
The dirty
supposed
ones?
to go. Yes.
Right, okay, cool, but now there's potentially a second life with them.
Occasionally, when you have a pile of linens on a surgical table afterwards, my team's going to go in there and try to sort through it. But occasionally, one or two will end up in the linen bin anyway. And when that
Yeah.
happens, they've already got a way on their end to kind of divert them out, so they don't throw them away unnecessarily.
Mhm.
And then they build up a little stock of them and sell them.
No, that's great. How did you find out about that?
It was the nurses who did all the back end work. The ones who suggested this had already done all the homework. So this for me was just about trying to connect the stakeholders. And as soon as everybody knew that there was an opportunity for this, and as soon as IPC kind of gave their blessing, we were pretty easy. We were ready to start. We just put the bins between the rooms, and then nurses started putting them in there. And then about once a week, these bins get full, and I bring them downstairs and give them to the environmental services department.
And was there a moment when you knew this project was actually working?
Well, I weigh them before I give them to them. So,
Oh,
I mean, over the first couple months, I think we're just, I want to say we're at like 1,800 towels. And
wow.
we've only been doing this since March.
And what does the janitorial team feel about this?
They're grateful because they don't have to buy anything extra to do targeted floor care
Cost savings on their end. Nice.
and waste reduction because we're diverting things out of the trash, at least in that first pass. So
Right.
there's some intention in there, which is great. But we're seeing,
Good.
so right now we're up at 2,400 units
2,000 units in, you said middle of August?
that was from March to the middle of August.
March to the middle of August. Okay.
Ballpark, it's going to be about a ton a year.
Wow.
I mean, that is a significant amount of weight, but in the hospital world, that's not that
Yeah.
significant of an amount.
Yeah.
It's a large volume if you try to visualize a ton of towels.
I can only
I have a hard time conceptualizing it, honestly.
Me too. It sounds massive. I might have to do some towel math after this.
well, if you spread them all out, I wonder what the area would be. That'd be kind of interesting.
Yeah, definitely. So, Julian, you run a team. Okay, tell us a little bit about your team. How many people?
So, including me, there's 18. They're from all over the world. Some of them have been doing this for 2 decades.
Wow.
They're all really, really hardworking, bright individuals who they prioritize teamwork, safety, and efficiency, and they're really grateful to work together. I give them this big song and dance. I'm a big Red Sox fan, and Major League Baseball has this awesome, I don't know what to call it, but it's set up where you got a bat boy, and you got the people who are guarding the foul lines, and they're there. They get all the balls that get into the fans, but then the bat boy runs out there like his life depends on it. He grabs the batting gloves, and he runs back. So I try to like use that as a comparison between my team and the nurses and surgeons. It's like, no, those are the all-stars. Like, those are like the Major League Baseball players. We got to support them like that kid supports the player who just got a hit.
Right.
Try to give them that as like an incentive. Now, whether it lands or not, I think they get the gist of it, which is really just, let's be enthusiastic about supporting these guys. They're really trying to help save kids' lives. And if you can't get behind them, I don't know what you can get behind.
Yeah, absolutely. Such an important and incredible mission. I can only imagine how motivating it is to go to work every day. It's wonderful. Speaking of motivation, how do you motivate your team or even beyond your team to see sustainability as part of their job?
Oh, that's a good question. Well, this is an opportunity for them to make a measurable impact. So I try to bring that information to them as often as possible without burning the leadership capital that they talk about. So try to be wise about how often I bring it up, but maybe once or twice every month or two is probably just enough to keep them engaged. And then try to get them to do things without telling them what to do. Like, nobody likes to be told what to do. So to try to show them through my own behavior is a good way to get them incentivized to want to help me. And then they want to help me.
Was there a turning point when you realized that your team was starting to see sustainability as their job too?
Yeah, I mean, I'm doing a green belt, a Lean Six Sigma green belt on these the single-use surgical item collection bins we have in the rooms. And so what we were doing is we'd have a relationship with a third-party vendor who will give us feedback on what we're putting in those bins. And so I had opportunity to connect with them, and here we were putting trash in those bins. Not deliberately. We were putting things that we thought were part of their workflows in there. And then to try to get different groups to adopt the right workflow, it's hard to do that without hearing directly from them. So just trying to bring that information to the appropriate groups. Essentially, this Greenbelt project has given us opportunity to ergonomically align things. So we've got the Sharps bin and the single-use collection bin next to each other. And then behind the single-use collection bin, we put some visual management. And so since doing these things, we've noticed that the third-party vendor has a lot less to point out, that there's not as much opportunity for improvement now, which is good.
Okay. Yeah. What's visual management?
So designs that have like a BCA, some Boston Children's Hospital specific instrumentation that we're using here. So it's not a different color cable. You have a physical picture of the single-use item that we're targeting right in front of you. When a surgical tech is breaking down the table, they are bringing the Sharps over. They're bringing what would go into a Sharps bin normally, because those surgical instrumentations aren't sharp. And then they're looking at it, they got it right in front of them. So it's like, oh no, this one actually goes in this bin here. And that's
okay.
So part of the Greenbelt project was getting these ideas from the groups, from the stakeholders, right? So getting representation of nursing, getting representation of surgical techs, and getting them to generate ideas, I think was really important to getting them to buy into this type of an initiative.
Yeah, because the ideas are coming from them or their colleagues.
Right.
That makes a lot of sense. And so tell me more about this initiative. So this is single-use items in an OR. What kind of things are single-use that go in this bin?
So they use ligatures, arthroscopic.
Wait, what's that?
Oh, it's all sorts of little bits and pieces that go inside of laparoscopic
Okay, so like very precise, tiny. I mean, all surgery is probably pretty precise, but
Well, just think like little tiny grippers that want to go in there
okay.
and grab pieces of tissue, and or like camera heads that are single use. So we have like
Oh,
laryngoscope handles and blades that they can use. And then instead of anesthesia just tossing that in the trash, we can toss it in this bin. And then they can
okay.
clean it and reuse it and resell it. What the third party vendor does is they give it to us in a really palatable way. They say, you've saved this many water bottles worth, this much poundage
Hmm.
of trash has been diverted. That's really helpful. And it puts things in a really, again, easy to kind of chew on bit of information. And then you bring that to the staff, and then they all want to do a good job. So you kind of empower them with the information, and then they make the right
How
decision.
did you find this vendor that would clean
Well,
and reuse and sell these single-use things?
the, the materials management groups did that, the supply chain.
Oh, great.
They've got great relationships, and then it's really cool, honestly. What they do is they've given them access to all of our usage of all of our materials, so they can
Uh-huh.
actually see on third party vendor can see they've introduced 100 of this, but we've only gotten back 30. We're only collecting 30% when we want to get to
Mm.
80, 90%.
Oh, yeah, that's really helpful. So because you know what's coming into the hospital and what's going in which bin to
Right.
come out. Got it. And with the team and motivating them, what resistance did you encounter, and how do you handle that?
Well, this was a new workflow. So at Children's Hospital, we actually have another vendor that will handle all of the sharps containers up until 1 p.m. And so after 1 p.m., my team does have to do some of the labor on that. So trying to
Okay.
leverage that. Originally, I had not a very wise approach to it, where I was essentially like, well, we do this already, we should do this too. And that
Ah,
didn't sit well with people.
uh-huh.
But once they saw that I was really committed to this and I was going to do this every week myself, they
Mm.
definitely wanted to help kind of alleviate the burden of me, which was
Mm.
I
Yeah, role modeling.
yeah,
Good.
but also just trying to help, and obviously no stigmas attached. If you were resistant to this yesterday, but today you want to help, doors wide open. We
Yeah.
got a seat right here for you.
Love it. Yeah. Good. Do you think that the OR staff sees this as climate action, or is it just good operations?
I hope they see it as climate action, and if not, then they see this as opportunities to. So we don't currently purchase anything that gets refurbished yet, but there are things in the pipeline. So I'm not trying to speak to future state.
Uh-huh.
However, this whole thing with a third party vendor, part of their mission is making things equitable for other community centers to be able to purchase these critical equipments at a more affordable.
Mhm.
So they don't have to sell them, it's not $1 to $1 once it's been reprocessed. You buy them new, and then when you're buying them refurbished, you're buying them, I don't know exactly what it is, but say it's 80 cents to the dollar, that's a lot of savings.
Have you seen anybody on your team step up as a champion in their own right?
I've seen a few different folks do this. Working with the group lead was really interesting on this. Um, Trying to collaborate and get ideas for how we would do this. Like, I didn't want to tell them how we would do it.
Okay.
I wanted to pull that out of them if I could. So trying to get them to think outside of the box and how we would do this, it turned out to be, it was a good opportunity for me to see how independent they are.
Mm.
I just asked them whatever they wanted to do to get this task done, I would support it. And the way they decided to do it was, everybody gets assigned rooms. And we're going to help you clean in those rooms throughout the day as a team. But your job, if you're assigned that room, is you got to input the data points, and you got to make sure that if we're going to say it's clean, then you did the final pass on that.
So like one person that's responsible.
Just to give that if we're going to say that the room is clean in the system, that's like your attestation that your name is attached to this, that you are
Mhm.
confident with the product that we're leaving here. And that gives me metrics on the performance side to work with the individuals and help calibrate performances and keep folks aligned. But
Okay.
giving them opportunity to extend their ownership of what's in those rooms, because the group lead's idea was, hey, if you're assigned this room on Monday mornings, the same day that the third party vendors are going to come in to collect, you guys just go see if those bins are full. And if they're over 3/4 full, leave them outside. And we're going to create an assignment where somebody's going to walk through with a big trolley, and they're going to take the full bins and they're going to leave you an empty bin. So then you put the empty bin back in where it was. The full bins, we put them in one spot, and then the vendor can come in on the same day that he goes to a neighboring institution. Instead of having to make a trip just for children's, they can come in here, and they can come in after they go to the service another set of ORs that are their neighbors, like right across the street, and they can grab all the bins we've got.
Yeah, what I'm hearing here is a couple things. One, you're really encouraging your team to be empowered to come up with ideas and suggest process changes and things like that. And then also, it's not just about like, oh, okay, let's start, sharing, giving these huck towels to janitorial, but it's about like the flow of the operating room. Operating room flow manager makes a lot of sense. But like, how are people going to be using this, and how do we move things from one area to the other? And so thinking through the whole kind of system of how this waste moves through and outside of the hospital is part of your role.
I'd like to at least get involved in things like that. I think
Yeah.
it's a privilege to be able to help this type of work at a hospital where there's opportunity like this, and it also gives opportunity to collaborate with on the floors. I get to work with the endoscopy unit, the radiology unit, up in the ICUs, because we used medical equipment up there as well. All the pulse oximeters that we use in the whole campus, we're trying to collect. So collaborating,
Pulse oximeters are
yeah,
the
the little
thing on your finger.
exactly, that tells you
Hmm.
how much oxygen your blood's saturated with, literally. So it gives me opportunity to stay connected with the ICUs, to get to work with the endoscopy unit, to work with the different spaces as well, and that keeps me busy and helps me keep my team busy.
Julian, if you could change one system or policy tomorrow to make it the OR more sustainable, what would it take? What would it
Oh,
be?
geez. Oh, if we set goals and they were shared um, and agreed upon ways to celebrate reaching those goals, that might be a good way to incentivize all the staffs that contributing to these types of initiatives to stay committed to them and to see them through.
Are you thinking about at Boston Children's or across hospital systems?
It would be great if we could do something across hospital systems. I was thinking
Yeah.
more so locally just because it's what I know, but I mean, if there was a way to do this on a more national scale, that'd be even better.
Do you work with other hospitals often, or
Not in this role, but through our employee-led group, I do have a privilege of being able to. So Catherine and our co-chairs of the employee-led group. So we've got Chuck Blanchett, who you do know, Julie Murphy,
yes?
who's a nurse, and we've got Prabhakar Devavaran, who's one of our anesthesiologists. They did the Eco Challenge this year in April, which it's across all the hospitals in the sustainability world. I think it's called the One Health Eco Challenge. And this isn't really down to hospital workflows. This is mostly like, if I eat a vegetarian meal, I can log in this. At the end of the month, it compiles all the Boston Children's Hospital employees who participated, and it's just a way to
Mm.
have healthy competition from one hospital to another,
Mm-hmm.
and a way to
Yeah,
kind
that's
of
cool.
track individual contributions from like, hey, I'd like to work today, or I took the tea, or I used my own
Right.
shopping bags, or I made sure I brought in my silverware to work today.
Okay. So that's like on an individual level, but maybe not at the OR level
Right. So that was a way to
yet.
kind of branch outside of just children's, and we got to see how we'd weigh in against Cleveland Clinic and all these other big hospitals that do really good things as well. Which I think this was started by the Mayo Clinic. I might be wrong.
Okay. Okay. And how did you guys do?
Collectively, we had a huge buy-in of participants, but then the individual participant level, we have opportunities to do better next year.
Okay.
But we do want to keep everybody as invited in as possible to this type of an initiative, and
Yeah.
to try to spread awareness and to try to help folks make targeted habit changes that they're choosing for themselves. I think that's all really good stuff.
Absolutely. If you could give one piece of advice to someone in another hospital operating room, where should they start?
Start within your chain of command, and if you're finding roadblocks, especially with something that you have a personal passion on, like try to remove the emotion from it so you can continue to work collaboratively and positively with everybody, because in order to get stakeholder buy-in for things like this, you've got to do it with the right foot forward, and nobody's going to
Mm.
want to work with somebody who's not able to regulate themselves.
That's a great tip. Very, very good. Thank you.
I certainly need to listen to it myself as well.
I can see you're very passionate about this, but we need that passion to keep moving. Where can people stay in touch with you or follow your work?
You can find me at Children's, and I love working with the environmental sustainability group here. And I'm hoping if anybody wants to stay in touch with me, my email is my first name dot last name at childrens.harvard.edu. So that would be one way you can reach out to me on email. And I'm always happy to connect and try to help in any way possible, even if it's down to taking feedback from others. Like, I really want to try to take that and bring it into action, because if somebody notices something, there's always a way to kind of have that what do they call it? Sponge or strainer. The sponge takes everything in, but the strainer will hold the good and let the rest go. And so to try to maintain a strainer attitude and take all the good from the feedback and try to implement it.
I love that analogy. Thank you, Julian. Really appreciate your time and for sharing everything.
Really appreciate the opportunity. I can't take credit for it. I got it from one of the TEDx talks that I was listening to. It was in a class I was taking recently. But self-growth is a really good thing, and trying to maintain optimism as we are all growing together is really good.
Absolutely. Well, thank you so much.
Really appreciate it, Louisa.
That conversation with Julian Inferrera really changed how I think about hospital sustainability. The changes don't just protect the planet. They support the teams who care for the patients and their families every day at Boston Children's. It's a reminder that climate work and patient care aren't separate. They're one and the same. This episode is part of Greener Hospitals, Healthier Futures, a multi-part series I've been so excited to bring you. And there's more to come. More interviews, behind the scenes, and ideas to take back to your own job. If you're enjoying the show, please hit follow, rate it, and share it with somebody. And you might also want to check out Climate Swings, a podcast all about people making the transition into climate. I'll see you next time. Thanks for listening.